Welcome back, Vitality Check podcast.
Thank you once again, Kevin, for putting together that music sample to start us off today.
You're welcome. It was really hard to put together.
Harmonica?
It's a few things.
Yeah.
Yeah, it's an instrument. I don't know what the name of it is, but amazing.
You played it for a long time, obviously.
Well, I've been taking lessons.
That's very obvious.
I know.
Yeah.
It's coming together. If you want to join us, you
I,
could play spoons or something, maybe.
Steph, are you a musician? Do you want to join in with Kev?
I have no musical inclination.
Zero.
No. Actually, my mom, when I was younger, brought me to a musical camp and they were like very unimpressed.
Band camp.
She can't be here. She must go.
Band camp.
Kevin,
Got kicked out of band camp. Got it.
because you were younger, you said you were at that
No.
singing camp,
No.
but not really sing. You're more of a hummer. You said.
No, that's Sean you're thinking of.
Oh,
He's the hummer.
well, Sean said he was like the songbird of his generation.
Yes, I did hear him say that.
Pretty sure he also said for his New Year's resolutions that he was going to sing live again because he did it once last year,
He did.
and he said he wanted to do it again.
I remember that.
Yeah. He will.
We should hold him to that.
Well, he's going to do it. Pretty sure he'll do it. Well, I'll laugh at him, but
He might be doing it right now.
he could be. Maybe that's where he is. I don't know.
He didn't come in today.
Doesn't tell us. He's just like,
Maybe there's no mic somewhere.
maybe there is.
Hmm.
Huh.
You track him?
Anyway, no, but oh my god. All right. So get serious. Sorry, we didn't mean to exclude you. It's just we got to get it out, or else it comes out in the podcast. Then it's just awful.
It's incoherent.
We'll save a little bit for like halfway, and then yeah. Go ahead. I've been introing.
Yeah. Well, first of all, getting serious. Thank you, Steph. This is Steph Baker's agreed to join us together today. Reluctantly. No. So Steph has been here for a while now as our physio. So why don't you take the time to introduce yourself? Tell her.
Bethany Baker. I made a mistake last time. Sarah, I didn't even say her last name.
You forgot it.
Probably.
So you can just
Pearson Legault.
Just
came back to me.
I even have my middle name on my degree.
Yes.
So often my patients will, yeah,
What's your middle name?
Daphne Diana Baker.
Diana.
Mm.
Were you named after Princess Diana?
No, my aunt.
Oh, close.
Very close.
We'll say it's Princess Diana.
I
Put that in the show notes.
I think my middle name is not on my. It is on my. I can't remember. I don't think so. I don't think that on
Jebediah?
It's not Jebediah. Close. Sorry.
I just see Jebediah when I look at it. Sorry, dude.
Oh, you're not the first one.
Right.
Anyway. Sorry, Steph. This is what happens when Sean's not here.
Yeah. Yeah, because Sean keeps the order here, for sure.
He's very good at that.
Oh my god.
Anyway, more importantly, Steph, please introduce yourself. Tell everyone, a little bit about yourself, a little bio. You can go as far back as you'd like, but maybe give people an idea of who you are and what brought you to this point of choosing physio and where you're at.
So when I was young, I was doing a lot of sports
Nice.
and had
Such as?
a lot of, oh my goodness, I've counted 12 sports.
Wow. Okay.
Yeah, and quite a few in competition as well. The longest one was soccer. I did that for a very long time.
Nice.
I didn't love it, so I don't know why I was in it for so long. But eventually I got into volleyball, and that was maybe
That is
fun. Yeah, and a lot more fun to play, I think.
Yeah.
Like I can't watch sports, I need to be playing
Yeah,
sports.
nice. I'm just saying that because one of my daughters plays.
Yeah. No, I really loved it. And I got, it was in CJEP mostly. So high school CJEP, I did a little bit of intramural in university. I did some horseback riding, I did some swimming competitions, diving. So very versatile athlete, a lot of injuries as well that just come, I think, from overuse because I was doing quite a few sports at the same time and always in the world of training. My mother was always at the gym and she would bring me to the gym with her. At the same time, and I grew up with scoliosis, so my back is a little bit curved, and I was followed for that in physio, and it was between the injuries and being followed for that, kind of
That naturally led you to physio?
Yeah, I guess so. It exposed me to it in healthcare, and I knew that when I was younger, a teenager, my whole family, they all worked office jobs, and I tried doing that when I was a teenager, and I was like, I know I will never sit at a desk for the rest of my life. So naturally, the next step is, or the direction is healthcare, at least because that's what we know. And because I knew what physio was, it was just an easy choice.
Nice. Good. What do you like to do when you're not at work?
I like to train. I don't do very many sports anymore, but I really
No.
like to just go to the gym, run outside.
Nice.
Yeah.
Do you run in the winter?
Whew, I did-
Outside, I should say.
Yeah, I run inside in the winter. I did one winter and then I just couldn't do it again.
Yeah,
Yeah.
it's punishing.
Yeah.
Yeah.
I'm really not good with the cold.
Yeah.
And I think every one of my patients can attest to the fact that I have really cold hands. So me and the cold in the winter just does not mix. And no matter how warm I get and how much exercise I do, my hands will not warm up.
So, what is it about physio that really kind of sparked an interest for you? Like, I know, like, obviously, like you're saying, being an athlete and having work done on you, but like, when you started looking into this, like, what was it about that kind of really caught your eye?
For me, it was just the almost immediate effects and the improvement in your quality of life. So you have pain and then you can improve so much function, decrease pain, improve, power when in your sports, or like jumping, how high you can jump. And it was just like these things that you could measure that were improving, as well as reducing your pain. And the effect was quite outstanding. And so it was something like, this person just gave me a couple exercises and did a little bit of manual therapy and I'm so much better. Like, yeah,
On
because
that note, I got a message from someone that you saw this morning.
okay.
That felt better.
Okay.
Nice.
There you go. I won't name call him, but
That's pretty rewarding, right? It's got a nice feeling. That's
Yeah.
awesome.
Yeah.
nice.
What do you find? Is there something like about your field or about physio that you find people sometimes misunderstand?
I think a lot of patients will assume that we did not go to school for a very long period of time and that we're mostly massaging. So they might see what we're doing as like massage and exercise, or it might they see physio. So if they haven't seen me, they might think physio is only exercise, and I don't want to go because I don't want to just be doing exercise. But it's just really trying to educate them that exercise is a big part of it, and we know through so many studies that that's what can really enhance your life, your function. But physio is so multifactorial in our tools and our abilities to help people. So it can be for sure exercise, it can be massage, but it can be manual therapy.
Yeah, you guys have such a great array of like post-grad courses you guys can take too. I think more so than a lot of other disciplines, you guys have so much access to continuing education courses and certificates and stuff you can get, which can, obviously tailor you to whatever direction you want to go into, right? Whether it's manual therapy or whatever it may be.
Yeah, and I think a lot of people get it wrong too sometimes, where they think physio is really for rehab after an injury, but there really is no limit to like what we can help and what we can do.
Nice, for
sure.
Yeah.
Well, there's always a difference in the perception out there in the population, but also too, even different styles, and just like any discipline, like an osteopathy versus, there's been many people that have seen us that say, oh, I've seen an osteo before, they didn't work like that, or even Sean as a chiropractor, doing longer sessions. The reason we hired you is, you're spending more time doing manual therapy than let's say the norm.
Yeah.
Right. So
they're using modalities or not using modalities.
Yeah.
Walking through like different ways of just different operating systems, right?
Yeah.
Nice. So maybe tell us, like, what is the most common issue that you see at the clinic?
I feel like I see a wide variety, but
or what do you like to see?
lately there's been a lot of TMJ, and that's what I like to see. And I can tell you a little bit about what led me to that.
Yeah, of course.
When I graduated, Instagram was just becoming more popular, I guess. And it was really great because when I graduated, it was a tool for me to see what are physios doing in the rest of the world. Because at school, it was very biomechanical and like exercise based. We were kind of moving away from modalities like ice, heat, TENS, exactly, and ultrasound. And like I only had this skill set, but I wanted to know what are other people doing? Because you know that there's osteos and there's acupuncture, like acupuncturists, and what else could physios be doing that's within our scope of practice? And so I was looking at physios in Australia, in the States, and it really was, it was not anything
No.
of what we were taught to do.
Australia is huge for manual therapy.
Yeah, but not just that. I found like nervous system regulation,
Yeah.
and I know you guys have talked about that on the podcast, but I'm looking at these physios in Australia, and they're really working on how you want to calm the nervous system before you even start with your manual therapy and exercise. And I was like, wait a second. Like, I went to McGill. I graduated in 2018, and this is the first I'm hearing of the nervous system. Nobody's ever talked to me about it. And so I took an interest in that right out of school based on thanks to Instagram and connecting me to these physios and their content, and taking their master classes. And then in the States, it was really what I was seeing, it was really big in myofascial therapy. So I'm like, what is fascia? And how come I wasn't told about it at school? And we didn't have a class on this. And starting to find classes or post-education classes for myofascial release, and just broadening my scope of practice and what I can actually treat. So one of the very first classes I took, I was looking for classes on fascia. And the clinic I was working at, they were the owner was basically giving classes on TMJ, and he's like, if you're interested in fascia, there's a little portion in my course on that. So I'm going to talk about the anatomy trains. And I was like, well, the class is free. Let me take the class. I didn't have an interest in TMJ, mostly because I think this is a similar situation with all physios. We don't have enough training out of school. So it's, a 3-hour lab. We get to practice our palpation, and that's basically it. And we're looking just at the jaw, not what influences it, not the factors, like the culprits that lead to TMJ, or really, it's very basic treatment techniques. And it was just muscle release. That's it. And not relating, like really working the neck in order to fix TMJ or like anything else related to it. Where was I going with this?
Why even?
Yeah, thank you. So I took this TMJ course, and I was for the fascia portion at the end, and I was like super happy that I got to learn more about fascia, but it was such a small course. But then I was like, wait a second, the TMJ connects to everything. So, and I was like super excited because, you're learning and you love this stuff. And so then I decided like, I'm going to start treating patients with TMJ because now I have some of the skill set for it. And I remember one of my very first patients, she had lived with TMJ pain, so jaw pain, for probably, I can't remember because this is almost, I want to say 70 years ago now, but she had lived with it for her whole life. The story was something like she was 13 years old, and back then, in the summer, her parents would send her on a pickup truck, in the back of a pickup truck, to go to the strawberry field and pick strawberries. And one day she was sitting at the back of the truck where, I don't know what it's called, the portion that kind of latches down and up.
Tailgate.
Yeah. And that day it failed, and they were on the highway, and she fell off and she just smashed her head. And she said all they did is they brought her to the hospital, they taped up her skull and sent her home, and she'd been living with debilitating jaw pain since she was 13, and nobody ever suggested, there's not a single dentist, a single doctor who said like, why don't you try physio, osteo, anything. And I treated her, and it only took a couple sessions, and she was like, I wish I would have known all those years ago. And she was in her 70s.
Oh my goodness.
Yeah.
Wow.
Right.
And I just remember thinking, I changed this woman's life. And the other physio it does change people's lives, but it doesn't change it as much on a level that's like your head, everything that happens around your head is going to affect and drain people so much more.
Not only the nervous system, like you said, like the impact of the jaw and the fascial system and the body, and how the mechanics of the body move, like it's huge.
Yeah,
it's huge. So yeah, you're right, like having an impact on that upper chain is so important for standing in gravity, for being able to
your higher neurological
regulate
system, right?
Yeah.
It's why when people see a chiro, everyone says, oh, every time I see the chiro, they adjust my neck. Yeah, because your body's adapting all the way to the very top. It doesn't want strain to go into your brain or brainstem, so it compensates as much as it can to prevent the headaches, the whatever going on. So
Mhm.
yeah, that's pretty profound. That's a pretty good success story.
Yeah.
Mm.
Wow.
But then you're in these clinics as well that don't really focus on the nervous system, right?
Right.
And so I'm really happy that I met you guys and I'm working here now because I feel like my focus has shifted back to that and it has so much more of a lasting impact
Nice.
That's
on
awesome.
patients. Yeah, because it's something I was thinking about it the other day. It's something that I was so interested in at the beginning of my career,
Yep.
but it takes a back seat because you're a physio, you're not supposed to be talking necessarily about the nervous system. This is not
Or it didn't fit the model of the clinic that you might be in or whatever, right? It's just a different model.
exactly.
So for people, I mean, why don't you just give briefly, like, people going in to see you, what do they expect? What is a session with you, initial session look like? Maybe walk us through quickly like, what that looks like.
So if we're talking, it's similar for any condition, but if we're talking in the, in terms of TMJ, so they're going to come and I'm going to ask them about their pain. How long have you had it? When did it start? Do you know what makes it worse? What makes it better? And try to identify any of those patterns.
Mhm.
Because sometimes like it's just about identifying something. I had a teacher once who said it could be as simple as you're always reaching to the left to grab your toilet paper and you're creating dysfunction in your thoracic spine and that's creating a problem. So it's just, do we understand what the, some of the culprits could be? So going through your subjective evaluation, trying to determine when did this problem start? How did it start? What helps it? What are some of the associated symptoms you might not think are actually having to do with that problem?
Yeah.
So like you guys were talking about TMJ and let's say like ear pain or tinnitus.
Digestive issues.
Yeah, exactly. Digestive issues. And also some of the culprits too you have to look at is, and I ask questions, but like people always say, oh, I didn't write that in my intake form because I didn't think it was relevant. And it's like you have to write everything because I'll try to decide what's relevant because abdominal surgeries is a huge one for me that I flag with TMJ. Like if you had gallbladder surgery or anything, but
C-section.
yeah, anything really in the body is gonna have an impact.
Yeah.
So yeah, any past dental work, like
Yeah.
major dental work, even any dental intervention, to be honest,
Yeah.
if it's more than like 30 minutes.
Mouth breathing.
Yeah, exactly.
There's a long
Were
list.
you a mouth breather when you were young? Did you have braces? Yeah, it's comprehensive, so it's a little bit long, and I know sometimes.
Yeah.
Does that too?
Yeah.
Nice.
Yeah.
I got a rapid fire to do.
Oh yeah.
Question.
Okay, go ahead. Yeah.
Quicker, a little more like doesn't have to be as long, but for fun. So would you choose desk job or active job for people?
Active.
Active?
Yeah. I could never say that.
No.
Stretching, love it or avoid it?
I prefer strength training, but stretching, yes. Just prioritize other things.
Ice or heat?
Heat. I almost never tell anyone to ice.
Foam roller, best thing ever or torture device?
I'm indifferent. I feel like it can just irritate more. I would rather choose stretching over a foam roller, depending on the area.
One exercise everyone should do.
Squats.
Nice.
Weighted squats.
One exercise that you secretly hate. Squats. No, sorry.
No, I love squats.
Burpees.
The hamstring Swiss ball bridge. That's hard.
That is hard.
That is really hard.
Yeah, that is
Nice.
a tough one.
Nice. All right. Let's see.
Well, I think that's pretty good. We're gonna, because
Yeah.
Do you want me to go through
No.
the rest of what I would do if somebody was coming in clinic?
Sure.
I know I was going
Yeah,
off on a tangent.
Yeah.
But to quickly just let people know, like expectation wise.
yeah, sure.
So the subjective is not all I would do. Obviously, we're not just talking the entire time.
Right.
But if somebody's coming, I'm gonna also evaluate what's going on. So and again, this applies to most injuries or pain, but looking at their posture first, strength deficits, muscle tension, more one side the other, more than normal, not joint mobility. We're gonna look at if your nervous system has been, not well regulated, the breathing,
Right.
How are they breathing? Scar tissues, I'm gonna maybe look at some scar tissue from surgery and see, is it really still exactly. Yeah, and then much, I think that's pretty much
Yeah.
covers it.
It just
Just-
makes it easier to game plan what's going on.
Yeah, evaluate everything and then give exercises based on what the dysfunction is and how
Yeah.
can we bring you back to what's normal. And then usually at the end of the appointment, there's treatment time. So
Nice.
Nice.
Well, listen, we really appreciate you coming on. Like it's a long time coming now that we wanted to have you on. Like we're telling you off air, you know, like we did an episode on TMJ, just a basic overview of that. Like we treat that so much too, and cranial stuff and as well. And I think we'd love to have you back on just to go deeper into certain topics as well, to help
of
people.
course.
The whole point of the podcast, right, is just to help people have a better understanding so that they can navigate through this stuff a little easier and have some tools that they can do at home to kind of help them feel better, right? So thank you so much for being on with us and putting up with our nonsense.
Thank you for having me.
And that's it. So
Yes.
until next time, until next week, we'll have another exciting episode for you. I'm not sure which one it's going to be yet, but hopefully everyone has a nice weekend.
All right. Take care, everybody. Ciao, everybody.